Hello, everyone. Chris Agerstrom, Director of Product Training and Development here at Jack Schrader and Associates, and wanted to put this video together for everybody to let them know what's going on in the Medicare space. You may have seen something over the past couple of days regarding Medicare launching a pilot program to cover GLP-1 medications specifically for weight loss, and that's going to be starting July 1st. So CMS kind of kicked this off last week. They released some additional information about the program. And I know that we got a lot of questions here regarding the cost. How do my clients qualify? What's going to be covered? Things like that. So we wanted to jump out ahead of this, let you guys know everything that's going on with this GLP Bridge program and what you can expect coming up in a little bit over a month and a half here. So let's jump into it. So first of all, this did just come out of nowhere. It's not like CMS is out there saying, all right, we're going to start covering GLP-1 medications for weight loss. They've been covering GLP-1 medications for a while, but specifically to treat diabetes or heart conditions, but never anything specific to weight loss. So what happened is back in December before Christmas this past year, CMS actually announced what they call the Better Approaches to Lifestyle and Nutrition for Comprehensive Health, or the BALANCE Model, and then a separate short-term demonstration, which is called the Medicare GLP-1 Bridge Program. And this Bridge Program is a short-term demonstration plan that's run by CMS that's going to give eligible Medicare members access to specific GLP-1 medications starting July 1st of this year, 2026, and running all the way through December 31st of 2027. So all the way through the end of next year. So the reason that they're doing this, if you go back and read the press release regarding the balance model and everything going on there, is CMS is a big believer, the Trump administration is a big believer that having access to GLP-1 medications for the specific purpose of weight loss is going to benefit the entire Medicare system as a whole. But the biggest issue when it comes to these GLP-1 medications, and you guys know this, if you have any of your clients who are on a GLP-1 medication, they're very expensive. And even with, some of the assistance that's available on Part D for getting prescribed them for diabetes or any of the heart conditions, that it can still be quite expensive. So this is Medicare kind of stepping in and saying, hey, these are great groundbreaking medications. It's already a $30+ billion industry here in the United States alone per year. How can we help our Medicare beneficiaries get access to these drugs, help them with their weight, ultimately help them with their lifestyle, help them with their nutrition? This is part of that process. So this demonstration program starts July 1st of this year, where they are able to get a specific, I shouldn't say specific, I should say they can get certain GLP-1 medications starting at a $50 or for a $50 copayment. So the list of medications was recently updated as early as just 2 weeks ago. So at first it was just Wegovy and Zepbound that were going to be covered by this, but they've, as of the end of April, they actually added Foundayo as well. So, and you may not be familiar with these ones. They're different than the GLP-1 medications that are being prescribed specific for diabetes. Those are, I'm drawing a blank right now, but you guys know which ones I'm talking about. Ozempic, which is essentially Zepbound. They're slightly different. So don't quote me on that. I'm just getting up to snuff on all this new stuff for these weight loss medications, but it's essentially the same formulation. It's just these medications are being prescribed specifically for the purpose of weight loss. And the reason this program is interesting is because CMS, if you look at the Medicare Modernization Act, which started Part D program back in 2006, 20 years ago, the law that was passed, the Medicare Modernization Act, specifically does not allow Medicare Part D to cover any weight loss medications. So what they're doing with the balance model, and then specifically this GLP-1 bridge program, is to provide access to these three medications: Foundayo, Wegovy, the injection and the tablets, and then Zepbound, which is just the quick pen. They're allowing access, or Medicare, or they're what's the right way to say this? They're giving Medicare beneficiaries access to these medications for the purpose of weight loss, and Medicare is actually going to be funding a lot of the cost because your clients are going to be able to get these for just a $50 copayment. Now, because this program is being run outside of traditional Medicare Part D programs, any of the money used to purchase these medications will not count towards a client's true out-of-pocket costs on their Part D side. They wouldn't anyway. If the client was taking a GLP-1 medication for weight loss specifically, that's not covered underneath Part D, so those costs weren't all already going to it. But because part of the qualifications for this is you have to be on a eligible Part D or MAPD plan in order to gain access to this demonstration program, it could be a little confusing, but just keep that clear in your head that if a client qualifies for this and they're getting those GLP-1s for $50, that cost isn't going towards the cost of their medications or their out-of-pocket maxes here, which is $2,100. So in order for someone to qualify for this, they must meet certain prior authorization criteria, and we'll talk a little bit about that. They must also be on a standalone Part D plan or an MAPD plan. They could also be in a special needs plan, an employer union group waiver plan, or they could be on the limited income newly eligible transition or the LINET program for individuals that have limited income and resources to participate. So if they're enrolled in the private fee-for-service plan, they're enrolled in the cost plan. If they're enrolled in anything else that does not have Part D or the equivalent of Part D coverage, then they're not eligible for this program. They would need to have like a standalone PDP as you see here on the screen. So they've got to be in a PDP of some sort, whether that's a standalone Part D plan or an MAPD plan. And then in order for them to qualify for this demonstration program to get those GLP-1 medications for just $50, they have to go to their provider. Their provider has to submit a prior authorization request that attests the beneficiary meets one of the following criteria. And the criteria is based on their BMI, their body mass index, and also whether or not they have specific BMIs with specific conditions. So the first qualifier is if you have a BMI, so if you're on Medicare, you're at least 18 years of age, you're on Medicare, you've got a Part D or an MAPD plan, and you have a BMI that's greater than or equal to 35 at the time that your doctor is prescribing this GLP-1 therapy. So it could happen prior to July 1st of this year, it could happen after. But as long as your client had a BMI greater of 35 at the time that they were starting this GLP-1 therapy, then they would qualify for the program. If they have a BMI of at least 30 at the time of initiating their therapy, and they've been diagnosed with either heart failure, with preserved ejection fraction, they have uncontrolled hypertension, which is essentially if you have hypertension, you're taking two medications to help with the hypertension, but your high blood pressure is essentially still uncontrolled, or you have chronic kidney disease stage 3A or above. So not quite stage 4 or end stage, but stage 3A or above, and your BMI is over 30, then you would qualify for this program. The last qualification is if you have a BMI greater than or equal to 27 at the time of initiating your therapy, and you've had a diagnosis of pre-diabetes. So this is not just the doctor saying, hey, you're pre-diabetic. You actually have to be diagnosed, and the doctor has to attest that you do have pre-diabetes, which is defined by the ADA, the American Diabetes Association. You have to have a previous myocardial infarction or a heart attack, a previous stroke, or you got to have some kind of symptomatic peripheral artery disease. So that's with the BMI of 27. So 35 is if you have a BMI of 35 or higher, no other comorbidities or any other conditions you have to deal with. That's just an automatic, hey, you qualify. But then there's that 30 and then 27 with those additional ones. So once you have a doctor that's going to give you a prior authorization, they have to submit that prior authorization and a request for the prescription for one of those three GLPs. Once again, that's Foundayo, Wegovy, and Zepbound. I want to go back here, make sure I got it right. Yep, Foundayo, Wegovy, and Zepbound. So they can submit one of those, and they have to submit it to the central processor for this, which in this case is going to be Humana. CMS is still working on the final kind of what does that prior authorization process look like as far as what form, or do you have to go online or things like that. The nice thing is with Humana is the central processor for this. So Humana is going to be doing all the paperwork on Medicare side as far as handling the prior authorizations, but then also handling the claims directly with the pharmacies. So they can go ahead and get those submitted. And the reason Humana was chosen is Humana currently does all of the LINET program. So if you have limited income and you need medication as you transition, There's that Linet program that's available, and CMS has a contract with them for that already. So it just makes it easier for CMS to go ahead and tack this onto them. So they're still working on the information to give to their providers because providers don't have to opt into this. They just need to understand how to submit that prior authorization request for their Medicare beneficiaries that would qualify for this program. And then pharmacies, they don't need to opt in. So essentially, see what CMS is going to do is CMS is going to notify all the pharmacies on how to send in claims to Humana for people that are bringing in these prescriptions for these GLP-1 medications that are now covered underneath Medicare when they traditionally have not been covered underneath Medicare, specifically for weight loss purposes. Now, the idea behind this bridge program, initially, the bridge program was supposed to run from July 1st this year to the end of the year, and then that balance model was going to go into effect for January 1st. In order for the balance model to go into effect, there was requirements for a certain amount of the Part D providers to actually have or say, yes, we want to participate in the balance model to be able to offer these GLP-1s to individuals. They did not get that threshold, which was 80% of all Part D carriers. So what they're doing is they've extended the bridge program, and their hope is that they can collect enough data to show the Part D carriers, that's both the standalone Part D and the MAPD carriers, to show the MAPD carriers that, listen, here's with our demonstration program, this is what the financials look like. Because a lot of carriers said, we're not going to get involved with this because we just don't know how it's going to work. So they didn't get involved in the balance model for 2027. So that's why the demonstration program runs for so long. So once carriers, or if hopefully if CMS can prove to the carriers, hey, yes, we understand these GLP-1s are a big driver in cost for not just Medicare, but also for group plans and under 65 programs. But hey, with this new balance model and the agreements we have in place, hopefully we can convince you guys to jump on board, because what will happen is starting January 1st of 2028, in order for those beneficiaries that are part of the bridge, the GLP-1 bridge through the end of 2027, come 2028, they need to make sure that they're actually on a plan that's participating in the balance model in order for them to continue that GLP-1 coverage for weight loss specific purposes. So I know it was a lot of information. It's only been a couple minutes, but I wanted to get this out to you guys as soon as possible. Now, if you have any questions on this, my recommendation, this is what I've been following because they update it pretty regularly, is if you can just Google GLP-1 bridge, and it'll take you to this website right here. So cms.gov/Medicare and the Medicare GLP-1 bridge. So we're still waiting for a couple things. Number one, we're still waiting for further information on how providers actually submit the prior authorization, even though CMS says they're going to send news bulletins out. If you have clients that want to participate in this, or they would qualify and they're very interested, and they go to their doctor in July and say, hey, I want to get my $50 GLP-1 shots, the doctor's going to look at them like they got two heads. So we're still waiting for some information so that we can hopefully get you guys what you need to help your clients get access to this new benefit. And then we are waiting for the possibility of adding maybe another GLP-1 medication to the mix. So right now it's Foundayo, Wegovy, and Zepbound. And then they'll be able to go ahead and get those through the bridge program. So pretty interesting benefit. It seems to me like we heard about it back in December of this year. It was kind of quiet from CMS as far as what was going on with the program, but literally over the past 2 weeks, this has definitely popped up. So maybe your clients are seeing it, or maybe they're going to ask you questions, or maybe you got something else to talk about when you're doing your birthday phone calls, new policy phone calls, what have you. So this is a brand new program. More information to come from CMS. It's pretty straightforward. We as agents are largely left out of it. So there's really not a lot that we need to do regarding this, but because it is a Medicare benefit, we definitely want to stay on top of it. So dig into it. If you have any questions, feel free to reach out to me or our team here at JSA, and we'd love to help you out with that. And it's almost summertime, so happy end of spring, and let's get ready for summer. Thanks.